Dr. Jeff talks love. Dr. Jeff talks life. Answers your questions, cuts through the strife. Sex and intimacy, real and true. Evidence-based, made just for you.
Hello. Welcome to Dr. Jeff Talks About Sex and Intimacy, where we explore both the science and the soul of sexual wellness. I'm your host, Dr. Jeff Alba, and I'm so glad you're here. Today, you're joining us for episode 46, Unlocking Intimacy and Fertility, Keys to Transforming Sexual Wellness. Whether you're watching live or listening to the recording later, thank you. I truly appreciate every single one of you. Your engagement, your curiosity, and your willingness to learn are what makes this podcast possible, and that's why we're here. We are connected across so many platforms. Find us on Facebook, on YouTube, on X, on LinkedIn, and also on Kick. If you're joining us on X and want to submit a question, hop over to YouTube, to LinkedIn, Facebook, any of those different sites, StreamYard, so you can post your question for us there. Also, if you are a Facebook person, please follow us, because the more followers we have, the more we can do on Facebook. Literally, the more people that follow us, the more things we can do. So we so appreciate every single one of our followers, and please follow us if you're a Facebook person. Visit the website. The website has every past episode. Wow. And we've got 40 some odd episodes on there now. You can go to the calendar, find out all the incredible guests that are coming next week, the week after, all the way through February. We've got stuff in there. So you can see what's happening on Dr. Jeff Talks About Sex and Intimacy on that website. You can watch previous episodes. You can pull up whatever you want to do. And I think you'll find that website very helpful. Also, you can take Dr. Jeff Talks About Sex and Intimacy wherever you go. Listen to us in your car, on a walk, or at home on your favorite music streaming source like Spotify, Amazon Music, iHeartRadio, and more. So we're there with you when you're working out or whatever you're doing. As always, I'd like to take this moment to remind and welcome each of you that all are welcome here. Whatever your sexual orientation, your gender identity, or your relationship style, this space is for everyone. Welcome. The mission of this podcast is so simple. It is to empower and enlighten you with the evidence-based information that you need that will improve your sexual health, hopefully deepen your loving relationships so that you can live your one miraculous, wholehearted life with more love. That's our goal. Today, what are we doing today? We're diving into a fascinating intersection where fertility, intimacy, and technology meet holistic healing. Our episode, Unlocking Intimacy and Fertility, Keys to Transforming Sexual Wellness, explores how we can better understand and support the whole person, the body, the mind, and relationship in their journey towards deeper intimacy and sexual health. My guest today was Kristen Karchmer, the founder of Conceivable, and she is unable to join us this evening. And I hope all of you will hold her and her family in our thoughts and prayers. She had a family tragedy and emergency, and unfortunately is unable to be with us this evening. But this is why I do the podcast, because I know the most amazing people out there, experts, and things line up so crazily, but this person is the perfect person to do this podcast. And I called them up on a whim, and they are going to be with us here tonight. So I am so excited to welcome my friend and colleague who stepped in at the last minute, Dr. Sandy Tenfeld. Dr. Sandy Tenfeld is a nationally recognized women's health nurse practitioner. She is a researcher and an educator whose work bridges integrative medicine, reproductive health, and sexual wellness. With more than 2 decades of clinical experience, and she literally worked in clinic with me when we both worked at North Shore, which is now called Endeavor, together in the sexual health clinic. And she is so known for her holistic, evidence-based approach to helping women navigate complex reproductive and pelvic health concerns. And actually, she helped men too in my clinic, and was awesome. Dr. Tenfeld is an associate professor and director of Women's Health Nurse Practitioner, and they've changed the name the Women's Health and Gender Related program at Loyola University Chicago, opening it up even wider to that. And there she trains the next generation of clinicians in comprehensive women's health. How cool. Her research focuses on pelvic floor dysfunction, sexual pain, and the impact of trauma on reproductive health. So, and also she works with innovative mind-body interventions, including mindfulness, integrative therapies, and stress reduction strategies to improve overall sexual well-being. Throughout her career, Dr. Tenfeld has been committed to enhancing access to compassionate whole person care. Whole person care. She's authored numerous peer-reviewed publications. We did some together. She speaks nationally on sexual health and integrative care and women's health, and she continues to provide clinical expertise that empowers women to better understand their bodies, improve fertility health, and strengthen their intimate relationships. And besides that, she is just an amazing human being, and I'm so proud to call her my friend and colleague. And welcome, my friend, at the very last minute. Thank you so much, Dr. Sandy Tenfeld, for saving us.
Oh, I'm delighted to be here. Thank you so much for inviting me.
I'm so excited about our topic tonight. So I'm going to have Vic pull up our presentation and let's get started.
Great.
All right. This is so exciting because honestly, talk about the very last minute, because this thing that happened to our speaker happened at the last minute, but life happens, right? So we learn to roll, we learn to be resilient, and that's what it's all about. That's what relationships are about, and also intimacy and fertility. So here we go. All right, so understanding the emotion and relational aspects of fertility. I thought we should start with this because I don't know about you, Dr. Tenfeld, but our patients, there's a lot going on with them when they're undergoing fertility treatments, right?
Absolutely. I think many couples, many people that are on the journey to explore their fertility options are confronted with a whole new range of information about their bodies and how their bodies work. And it also brings into a different context their intimate relationships, right? Many people who are going through fertility treatment are doing this with a partner. And I'm glad that you said in the beginning that your introduction that this is for all genders. So often we refer back to the binary and talk about women or men or their sexual partners. We know that it takes an egg and a sperm to create a pregnancy, but there are many ways that this can be created. So if we fall back on the language of heteronormativity, please disregard that. We're going to try our best to be inclusive because all relationships can come under strain. Mm-hmm. Many individuals, when they're coming into fertility treatment, if they had been able to conceive spontaneously, it's a very different story. But when you make that journey into the world of infertility and you're learning about all of the biologic mechanisms that go into this, it can kind of take some of the fun and the intimacy out of your relationship.
For sure. And as we say here, it can cause that emotional strain. It's stressful because you're looking at timing things and, doing different things. And then if we don't do things the old fashioned way with penetrative sex intercourse, or we can't do them that way because we have a female or male female or insemination or whatever the situation is, now we have to deal with how are we going to get that sperm and that egg together, which is the goal of the fertility, right? And that can be challenging and super stressful. And then you add in often that One of the persons is on hormone treatments to get all that going in the right direction. So I just think that fertility, it causes significant emotional stress and anxiety in our patients. And I know in our journey, my wife and we had to do some of this, and I remember the medicines and the different things that we had to do to make things happen the way that they need to happen, and it is stressful. And I also remember thinking, it's never going to happen. It's not going to happen. But guess what? I have two wonderful sons to show it does happen, and you do get there. But when you're in the middle of it, it feels like maybe it's never going to happen for sure.
And often one of the partners or both of the partners can feel broken, right? That there's some type of deficiency in their ability to conceive. And that can put an additional performative stress on their relationship, and looking at the ways that they can be intimate with one another when they may be harboring some feelings of guilt or inadequacy.
And that's such a good point. And it's nobody's fault. It's not the person's fault who has the infertility issues, or anyone's fault. No one wants these things to be the way that they are. So I think it's really important to, like always, take that shame and blame out of there. But often we feel unworthy and defined by that. I'm broken. I'm not whole. Everyone, and then you look around, you're like, everybody else has kids. Everybody else is prolific. What's wrong with me?
And there's so much shame that many people have in terms of their baggage in relation to their body and their ability to function however we define normally, and shame around sex. So when you compound it with health issues or fertility struggles, it can just make a very complex situation even that more challenging for a relationship.
Yeah, and we're not used to communicating about sex, right? I always say our vocabulary is yes, yes, or they're not sentences. So
Right.
it's difficult when there's challenges with the communication and the connectedness, when it's like, oh gosh, we have to deal with all these logistical things or medicines or whatever we have to deal with. That too, we feel like this is not the way it's supposed to be. But how is it supposed to be? Because it's the way it is. And
Every journey is different.
yeah, every journey is different. So yes, it can. So emotional strains and with fertility, as well as the impact on the relationship. And so I think really that compassionate emotional support, really seeing and recognizing each other and the journey that you're taking together, which is an incredible journey, is so, so important. So that compassionate support we can give each other when we love each other so deeply and profoundly is really important. So fertility also impacts, when we think about that emotional impact and the struggles that occur with the stress, the uncertainty, what's going to happen, what are we doing? And I have to go in the office and this has to be done. And I think that can be really challenging, and that can also affect desire. When you have to time things sometimes too, it's like, wow, you may not have time for the desire just to necessarily be there, but
Take some of the spontaneity and the creativity away from our connection, and at the heart of why you're joined together and why you're coming together, and hopefully that intimacy is the bedrock and the foundation of your connection. But often, there are many more ways to be intimate than just putting a penis inside the vagina, right? So that may be one piece of this puzzle in order to get the sperm where it needs to go. But at the same time, we want to acknowledge that the stress that happens can be disruptive to a relationship. And often you put a happy face on and you're like, oh, this is exciting. But people that are going through this journey often know that it's a lot of hard work, and it's a lot of strain and emotional stress and financial stress and relationship stress. So acknowledging that these struggles can cause the stress that can perpetuate, undesired outcomes in a relationship is really important for us to be able to at least to name that. And I think it goes back to something that you talk about a lot, Dr. Jeff, is, the communication, right? And that idea of really being close with your intimate partner and being able to have those conversations about what you're experiencing, both emotionally and physically.
Mm-hmm. Definitely. And you're not alone. So many people struggle with infertility. You're not alone. I think that's really important to remember too. So don't think that everything's perfect for everybody else, but not for us. You know, it's not uncommon. So really, it's quite common, and you know, plenty of folks. About 80.5% of married women ages 15 to 49 are infertile. That's a lot of folks. About 26% of women that say in that same no prior birth group report difficulty getting pregnant or carrying a pregnancy to term. So a lot of people struggle with fertility. A lot of people struggle with pregnancy. You are definitely not alone. So please realize that. That's important to know.
I think we're finding more and more resources out there. Patients are being more proactive as they recognize when they start thinking about when and if they decide that they want to parent and considering their fertility options. So I've seen, patients in my practice come back and we have these conversations early and often, whether or not they're planning on having a pregnancy right now or if they're thinking about it 5 or 10 years from now. We discuss ways to help keep your body healthy and when we might need to intervene if a spontaneous pregnancy hasn't occurred. But I think that, many people will hope and wish that this would happen spontaneously when they're ready. We live in an environment where people are postponing their fertility and they're planning it, more clearly because they want it to coincide with their career when they're going to be done with school or, when they are financially ready. And often, our bodies don't respond quite that way that our clocks may think that we do. So I think that can set us up for some disappointment. But having a clinician that you can talk to openly about your family planning ideas and advocating for yourself and having the health promotion pieces in place to optimize your health before you try to become pregnant. And if you do run into challenges with fertility, knowing what your options are and what the resources are, both in terms of your emotional and your physical support, is really important.
And two, when you think about how often it occurs, you think that's like 1 out of 10 people struggle with it. And then two, you think, well, is it more people with penises, people with uteruses, whatever you want to say, male, women, whatever you want to call it? It's pretty equal. Both have difficulty. So you're not alone. And there's lots of people out there. And we're going to talk a little bit about some holistic approaches and just a little bit of logistical things and things that might help you on your journey. But certainly nothing substitutes having a really good fertility specialist to work with. And there's wonderful people all around the country. So that's very important. So we were talking about communication, as you said, and so encouraging really that honest, open dialogue and building that trust. This is such an important thing, and it builds that deeper understanding between partners. It's such a challenging thing, but it can also be something that can pull you closer together and make you stronger when you come out the other side of it. It may not feel like it when you're in the middle of it sometimes, but when you come out the other side, but that communication is really going to be key. Talking about your feelings, talking about your frustrations, really important.
Yeah, many people can feel pretty isolated. Any type of health problem that you're encountering can be very challenging in terms of acknowledging when you're under stress or when you're feeling inadequate or when you're no longer enjoying your intimacy because you're looking at this as just a means to an end, right? Like you have timed intercourse, when you're ovulating, or when you need to go in and have, a procedure done. It can take some of the mysticism, some of the connections, some of the beauty away from something that can be really important in a relationship. So when you start noticing those changes, when you start feeling isolated, when you start feeling that it's more important that you're tracking your basal body temperature to know when you're ovulating or, measuring out the hormones for the injections and trying to figure out when the perfect timing for your timed intimacy can happen, that's when you really want to reach out because it can reduce your relationship in a way that may not be as nurturing and supportive. So, being able to speak up and have that communication is super important.
Definitely. And then that empathy, that just put yourself in your partner's shoes. And, if you want to be understood, do you want to just as desperately understand your partner? That's where empathy comes from. I really want to know what it feels like for you and how can I support you? So I think that's really important. And then creating some shared meaning and goals around it. Sometimes you just got to say, you know what? I think we need to take a break. I know we both want this, but we need to take a break because fertility practices can be overwhelming, especially when you're on the schedules and a little bit of the different things we're going to talk about in a minute. It can be a lot to go through. So creating those shared goals can be really important. So how do you approach this? Well, we're going to talk a little bit about, just like you said, those temperature different gauges to see when you're ovulating, ovulation kits and tests and all kinds of things that sometimes can feel like they take the fun out of intimacy and sex, but they don't have to, but they can rob you of it. So we'll talk about a little bit of that. As well as we'll talk a little bit about some complementary therapies and things that you can do for overall reproductive health and some lifestyle adjustments and things like that as well. We like to, this is what's so great is we both practice together and we both approach things from this a multidisciplinary approach with conventional, complementary, and lifestyle adjustment changes. So we're going to talk a little bit about all those things. Okay, I'm going to hand this one over to you a little bit, but I remember the ovulation kits. I remember the temperatures. I remember all the fun stuff that you do with all this.
Right. We often think that, monitoring your menstrual cycle should be an relatively easy thing to do. We think of having a period once a month, but in reality, there's a wide variety of what's considered normal. And every person who has a uterus and ovaries is different. So we're not all on a lunar calendar where it's every 28 days and we bleed for 3 days and we have no pain and everybody looks the same. That's not accurate. There's so much beauty and variation in the way that we present. And one of the things that cycle tracking really allows you to do is to get to know your body. This is something that we often intellectualize, right? Maybe I'm just speaking for myself, but I spend a lot of time in my head. I think about a lot of things. I like to see the data. I like to know what's going on. But the idea of really monitoring your fertility encourages us to be more in tune with what's happening with our own physiology. So every woman is a little bit different. Keeping track of your period is one good measure for us to know how often you're cycling and with what regularity. We time periods from the first day of your menstrual bleed until the next first bleed, right? So the first day of your last normal menstrual period is something that you would keep a track of. And everybody is different in terms of their cycle. Some people can have some abnormal uterine bleeding and can have periods that are further apart. So typically anything that is shorter than 20, I think it's 22 days on the short side, or up to 35 days, that can still be within a normal range. The amount of bleeding that you have may vary from person to person. I say patient because I'm a nurse practitioner, but from person to person. The regular menstrual cycle will allow you to know if the hormones are working in your body. Every month, blood builds up inside your uterus and waits for a baby to come. And when there's no baby, you have a menstrual cycle. You have a bleed. It doesn't allow us always to know if you're ovulating. Ovulating is the job of the ovary. There are hormones from our hypothalamus that send messages to our anterior pituitary to release the hormones from our ovaries. So it's this big cascade of hormones that need to be working in synchronous to be able to allow for ovulation and allow for menstruation. And it's hard to know where the breakdown happens. So you might be having regular bleeds, but you may not be ovulating regularly. So there are additional steps that you can take. There are some ovulation kits that you can buy over the counter. We talked a little bit about basal body temperature that you can take in terms of knowing when you are, and I'm not going to go into detail here. You can find this, you can find resources on this as well. But taking your temperature is one way to know when you're ovulating. And there are fertility kits that know with ovulation as well. So often I'll see patients that come in and they have done some of this troubleshooting on their own. The definitions of infertility, most couples will spontaneously conceive within 1 year of trying to get pregnant. Okay, so if you're not using contraception and you're putting the penis inside the vagina and they're ejaculating, most patients and couples will conceive within 1 year. Under the age of 35, within 1 year is typically what we look for. So people may want to track their fertility and figure out how often they're menstruating and when their most fertile windows are. After the age of 35, if you have been trying for 6 months and haven't been able to get pregnant, then that is something that we would intervene on sooner. We wouldn't make you wait a whole year after the age of 35 because we know that the rates of fertility do start to decline with age.
Yeah, and that's so important. And I do remember, like with the temperature thing, you have it right next to your bed because you're not supposed to move. You lay in bed, you put it in your mouth, and you take
Right.
that temperature every day, and you monitor and you watch it for trying to figure out when you're going to ovulate. The ovulation kits too, if you're wondering, you urinate. There's different things that you do with the different kits, and it tells you when you're ovulating a little bit more. So all these are tools that help you know a little bit about ovulation and when it might be occurring. So whether you're using insemination because you're not partnered with a penis and vagina, however that is, whatever is going on with that, whether you're inseminating, whether you're having sex, you're timing it with that ovulation a little bit. And that's where it can get a little stressful because it's like, hey, noon today. This is the time. This is the
Come
place.
home, let's get sexy.
But that menstrual cycle monitoring is a big deal. And and then, regular self-care routines support hormone balance. And we're going to talk more about that with nutrition and different things in a minute. But there are also a few things that might help you. Again, if you're an app person, there's several different cycle monitoring apps. You'll find a bunch of them out there. There's Flow, there's Clue, there's Glow, there's Ovia, there's Natural Cycles and Fertility Friend. Some of them, the simpler versions, are free. So you can download those if you're that kind of person and you like that kind of thing. You can as well, temperatures and symptom tracking, different things. You can keep a log of these different things. You don't want it to consume your life, but it can help to do some of this tracking. And then you could incorporate some of the lifestyle data. Each of these things are just a little different, but for example, so you can kind of look at these different programs, but like Flow is sometimes recommended as an overall choice. It's downloaded quite frequently, and it offers personalized experiences for tracking cycles, ovulation, and pregnancy mode. Clue is it offers a free basic version and a paid conceive mode for fertility insights. There's Glow, which has a free version and a premium subscription. It offers related apps and things. Several different ones. Avia, Natural Cycles, Fertility Friend. It was highly rated, especially on the iPhone. But again, you got to figure out what's right for you, and working with a fertility expert as well. It can be a lot, but we just wanted to give you some of the technology that might help you with this as well.
Absolutely. And it's really easy to get overwhelmed, okay? So as somebody who loves data and loves to understand what's happening with my body, I can understand when there are challenges or when you're not conceiving as quickly as you would like to, or if you've been trying for years. As we've mentioned, making sure you've got a good support system, having those conversations not only with your partner, but also with your healthcare professional, because they will be able to sit down and say, okay, here's some preliminary things that you can try on your own. Optimizing your health and your wellness is going to be better for you in the long run, regardless of if you're able to conceive or not. There is no magic wand that says you need to be a certain BMI or, meditate every day until you are, reaching nirvana and then magically you're going to conceive. These are suggestions to be healthy. If you can lead from that point of health, then hopefully that will help to optimize your fertility. But sometimes you feel like you're doing everything right. You're eating the right amount of food, you're getting enough rest, you're reducing your stress, you're tracking your cycles, you can still experience stress. And sometimes that stress, we somaticize stress. We can take this internally into our bodies
Mm.
through no fault of our own. We think we're doing everything right. You are doing everything right. But at the same time, it can be really challenging to know what needs to happen. And that's where having a good support system and recognizing when you need some intervention or when you need some medical therapy or when you can work to reduce. And there's actually some really good data out there looking at ways to, when you're dealing with a stressful health situation like infertility treatment can be, reducing your stress through complementary and alternative therapies. I know we're going to talk about this in a minute, but reducing your stress can help improve your fertility outcomes.
Yeah, so many good points that you just made. But first off, the thing I love is that you said, whatever your fertility journey, whether you get pregnant or not, it's about you, your body, and your health. What better thing could you invest in the world than your own health and your own life? I can't think of anything more valuable. So I love that you stress that. I think that's so important. And yes, we're going to jump into some of that, just getting healthier. And you hear us talk about this all the time. When we're talking about sexual health in men with penis, people with penises, men, women, people with uteruses, we're always talking about really getting healthy and how important that is. So yet again, we're going to talk a bit about that now. So really, the different things we want to talk about that are so essential to sexual health are proper nutrition, regular exercise, and quality sleep. Those are just hallmarks of really good health. While you sleep, we've talked about all these incredible things happen with sexual health. In men and women both, testosterone builds while you sleep, and that is one of the important hormones when it comes to sexual function. And then while you sleep, other things, your body rejuvenates. So many important things happen during sleep. Sleep is critical, and getting into good quality deep sleep is very, very important. We've talked many times about that diet, a really good diet, that heart healthy, overall healthy diet that's lower in fat, lower in cholesterol, but you do need some fats with pregnancy, and you do need some of these things, the good ones. So we'll talk more about that. And then low carb, but at the same time, you do need some of these things. So we will talk a little bit more about that. And especially I'd like to hear from Dr. Tenfeld, because I know they're like, don't get too thin. Don't go too crazy with the dieting when you're trying to get pregnant. And then, of course, the regular exercise program that's already in place. So if you do get pregnant, you can continue some of that, maybe modified or whatever. So I'm excited to hear what you have to say about these three super important, this incredible triad. There's nothing like diet, exercise, sleep, super important.
I think as nurse practitioners, we come from such a place of health promotion and disease prevention, right? So we are trying to optimize health through these conversations about what it means to be healthy and what that looks like for you. Everybody has a different idea of what nutrition looks like. And I think we are learning more and more about nutrition, especially from a healthcare perspective. I think that anti-inflammatory diets can be really helpful. We want to make sure that your health is optimized. There are certain conditions that people could have. If you don't know if you have pre-diabetes or if you have diabetes, these are things that can complicate a pregnancy. And they're very much reliant on your metabolism, right? So we look at things as more of a metabolic disorder. When you're carrying around a little extra weight, or if you're too thin, you may not have the resources and the hormonal fluctuations to be able to have a regular menstrual cycle, right? We see that in some of our patients that are too thin that have anorexia and their cycles go away. If you are, extremely dieting when you're trying to get pregnant, your body may think that you're under stress, and it's not a good time to conceive, okay? So trying to really nurture your body and nourish your body with the right selection of foods. Again, I'm a big believer in an anti-inflammatory diet, trying to limit the amount of processed foods and limit the amount of sugar in your diet, white flour. These are things that are so insidious that can be really detrimental to our health and our overall metabolic picture. So trying to really make sure that you are not restricting your calories. If your body thinks you're in a starvation mode, That can be your body might be saying, hey, I'm not going to get pregnant right now. Our bodies were created a long time ago, right? Before there was a grocery store on every other corner. So we want to make sure that we're giving the right food at the right time to our bodies, because nutrition is really important. Another important thing is folate or folic acid. Many of our foods are supplemented with folic acid. A prenatal vitamin has folate or folic acid in it. And that's the only thing that we know that helps to reduce the risk of neural tube defects like spina bifida. So this can help reduce your risk of miscarriage if you have the adequate amount of folate in your diet. You can also get this from green leafy vegetables, and meat has folate. So there's other ways to obtain this. But typically, if somebody is trying to conceive, I encourage them to take a multivitamin that has folate or folic acid in it. And, as Dr. Jeff was talking, regular exercise, we know that blood flow is important for our bodies, right? And the more we are able to exercise and get our cardiac, our aerobic exercise in, that helps to move blood around our bodies and strengthen our muscles and keep our bodies strong and healthy. Getting pregnant is a very physically demanding process that happens in a body. And the stronger and healthier you are, the more optimal your health prior to pregnancy, it may help to minimize some of the aches and pains and complications that can happen during pregnancy. So that is also super important. There are some exercises that we strongly encourage, prior to pregnancy. Whatever you're doing, as long as you're moving your body and staying healthy, is great. Once you become pregnant, there are certain things that are contraindicated. We really don't want you to do downhill skiing, or hot yoga is something else that's contraindicated during pregnancy just because of the extreme heat that you can experience. But find something that you love to do, and I think this is important for how we approach health, is that finding the foods that you like to eat that are healthy, that are nourishing, finding the exercise that you love to do so that it doesn't feel like a task or a chore. As we shift into, the fertility treatments, everything can be so prescriptive, and it can take the joy out of eating or the joy out of exercise or the joy out of sex. And that's not what we want. We want you to be healthy, and we want you to optimize your health, and hopefully that will come along on your fertility journey as well. Some of that sweet time can be used in cuddling, and feeling supported and loved. It doesn't necessarily, I sleep better when I'm spooning my husband, but that's just me. And everybody's different with that. But I think that idea of connection and feeling safe and feeling comfortable will help with relaxation. It helps move us into the rest and digest, the parasympathetic part of our nervous system, and out of that stressful fight or flight where we often spend when we're worried about our lab tests, or we're worried about the cost of fertility treatments, or we're worried about, taking time off work to go in for another appointment, or the challenges in a relationship, right? We have to find this balance between the stress in our lives and the ways to decompress.
And if you look out there now, it's really funny because a lot of us grew up with the food pyramid, but the food pyramid's gone. Now it's the food plate, and you don't see necessarily processed foods on there like chips and sugar and all this stuff. It's not part of it. So it's really looking at your body's needs, and certainly, like you said, some of those important vitamins, but also those fruits and vegetables, that plant-based diet, those different things are so important. And then certainly the exercise. So many great studies have come out in the past decade or two about how exercise transforms sexual health. Remember,
Right.
the uterus, the penis, the ovaries, all these things need good blood supply. Genital arousal requires good blood supply. So blood flow is a really important thing. And that's why we talk so much about exercise. Your body was designed for it. So, but I love what you bring up. Find something you enjoy. Like for me, I don't want to be on a treadmill looking at a TV. I want to be outside at the lake walking if I can. Even if I have to bundle up, I love to be outside when it's possible, doing my walking, my stepping, my whatever outdoors. What is it for you, listeners? What is it that you enjoy? And maybe you're like, I just hate exercise, but
Have a dance party, play some music and move your body. There's
dance
so many
party.
ways.
I love it.
Yeah, so many ways. And find a partner, right? Like, what a great way to get your groove on and to move your body and to feel active and also to build connection. There are lots of insightful ways for you to not make this such a chore so that it becomes something that is unenjoyable and you're just doing it for a means to the end. This is something that should be, an important part of your daily routine so that you can find connection. And I just gotta share. I hear Dr. Jeff's voice in my head all the time because he talks about blood flow and nerve conduction, and how important that is for the genitals all the time. So I have taken your words and I use them all the time with my patients when I talk about sexual health. So thank you for those. Thank you for that.
I'm sorry, my voice keeps playing in your head though. That's kind of scary.
That's okay.
But
I take the best from everybody.
I love it. But the Sleep Foundation has some wonderful sleep hygiene ideas and thoughts. And so what's right for you? Some bodies need a little more sleep, some need a little less, but we all need sleep. So these are foundational things for overall health, and certainly along with fertility as well. But we always love to talk about these practices as well. So important. Mindful practices, breath work, physical activity benefits, which we just talked about. But let's dive just a little deeper into some mindfulness and breathwork things.
Yeah, I'm also a certified yoga instructor. So I went back after my degree to become a nurse practitioner. I have a master's in that. I'm a PhD as a researcher. But what I realized was the importance of complementary and integrative therapies for our health, and how we need to be advocating for that for not only ourselves, but for our patients as well. And being able to talk about that mind, body, and spiritual connection that practices can help us achieve through mindfulness, through yoga, through meditation, through breath work. These are things that should be incorporated into our approach with Western medicine. There's some really good data out there that looks at stress reduction for people that are going through difficult treatments, whether it's infertility or cancer treatments. There's a whole science that looks at the mind-body connection through psychoneuroimmunology. And it is more than just, this is a good thing to do, but there's actually some strong data behind it on how this can be helpful along your journey.
You see those PhDs behind both of our names? We are huge proponents of science. Trust me. And this is what's crazy. People think Eastern medicine doesn't have the science. It has just as much science. There's all kinds of good science behind acupuncture, behind meditation, mindfulness, presence. So much good science. So look for yourself and find the science, because trust me, it's there. And mindfulness is a practice I work. Honestly, there's not a patient who walks through my clinic that we don't talk about being mindful during sex, being present and focusing on the sex rather than letting the anxiety creep in or the judgment. A lot of us are like, we think it's the Olympics. We're standing on the side giving scores and stuff. No, this is not presence. This is not good. And breath work. Now we're going to do some of this at the end of this podcast. So of course you're going to experience that yourselves, because we always do at each podcast. Breath work is incredibly powerful. I just had a guy in my clinic, and he's like, I'm so stressed. I'm just so stressed. And, she wants sex more, and there's so many things, but I'm just stressed about my life. And I'm like, okay, we're going to do something. I hooked him up to the blood pressure cuff and the pulse oximeter. And I said, okay, let's see how you are right now. Okay. Blood pressure was up there. Pulse was up there, everything. And then when we finished, I said, now let's do some breath work. His partner was sitting in the room. She's like, oh my gosh, his blood pressure dropped 50 points when we did the breath work. 50 points, his systolic blood pressure. Breath work is powerful.
It's one of the few things that we can control. Okay. So you can control your breath. You may not be able to, you can't control your blood pressure or your heart rate, but it's through the breath. The breath is the conduit to connecting the mind and the body and the spirit. And that is one of the things that, and it's so nice to do it, because this is something that's portable. You don't have to go to a fancy class. You don't have to buy Lululemon clothing. Not that Lululemon clothing's bad, but I think we put all these barriers on, are we doing it right? Or is this okay? Or, I don't have time for this. And we breathe in and out all day long. We just don't pay attention to it. So it's that mindfulness, it's that ability to turn your attention inward and really listen to what's going on with your body that may be helpful to reduce the stress and to give you a deeper sense of connection not just to other people around you, but to your own body, which is so important. Again, we spend a lot of time up in our minds, and that's where our stress and anxiety and our thoughts and our,
Our trauma.
the trauma, the negative messaging that we
Mm,
say to ourselves over and over again, especially if you feel like you are broken, especially if you feel like you're inadequate, or if you feel like you're on the sideline being judged, at the Olympics.
it-
This
yeah.
is this is just an opportunity for you to get a little bit deeper connected with yourself, which hopefully will translate into a deeper connection with your partner, and perhaps reducing the inflammation or the stress and the other parts the dysfunction that may be happening, that prohibits fertility.
And your breath goes where you go. You can use it anywhere, anytime. So you're freaking out and you're stressed at work. Don't think that Sandy and I don't. So if you have to, you run in the bathroom, because nobody's going to follow you into that stall, and you do your breath work. Or if you have your own space, you stop for a minute. You go and you breathe. I've had patients who have a closet where they go to do their. You can do it anywhere, anytime.
Mhm.
So it follows you. It goes where you go, and you can use it, and it's powerful. So all these things are really important and a part of the journey towards wellness. No doubt about it. We've talked a little bit about this and alluded to it, but even more. So we talked about meditate. There are so many amazing studies on the power of meditation and how healthy it is for your overall health. And it certainly helps as well with your journey towards fertility. And yoga, I'm going to allow you to, I'm certainly want to hear from you on those. And we talked about breath work already. So yes, let's talk more
I
about.
see these as intertwined,
Mhm.
so I mean, they're components of a bigger picture, right? So when we look at mind body therapies and ways to reduce our stress and to optimize our health, these are all components that fit really well together. You may feel more connection to one or the other. You may try all three. There are many other things that you can include in this list. But I think that, the idea, again, I keep coming back to this connection of your mind and your body with the
Mm.
hope of tapping into that deeper inner spirit, right? I've been meditating every day for 7 years, and I do different types of meditation practice depending on what my needs are. Some are very cerebral, where you're just repeating a mantra and you stay very much focused in your head, trying to slow down the other thoughts.
Mm.
That's great for me when I need to focus and eliminate, the distracting noise that's in my head.
Mhm.
However, there are other types of meditation, and I think of Yoga Nidra as one, which is a guided meditation, which allows you to bring your attention to different parts in your body, so that you're connecting your mind and your body by thinking about these different parts, and it's really a grounding type of meditation. So the Yoga Nidra is one way to have that mind-body connection. There are also lots of meditations that are focused on the breath, which is really a powerful way to think about how important it is to be able to control your breath, slowing your breath down, switching you into that parasympathetic and the rest and digest side, and out of the fight or flight mode.
Crisis.
Yeah, absolutely. And I practice yoga, and I've done pelvic floor research related to yoga and how we can help reduce inflammation in our bodies. So I've looked at, pelvic floor through the lens of incontinence when you leak urine. But the pelvic floor benefits from having a mind body practice allow you to understand what's happening. I know we've got to talk a little bit more about, a tight pelvis versus a more relaxed pelvis, and how that can be helpful or inhibitive for healthy sex. But I think it's just an opportunity for you to get to know your body as a compassionate observer of what your body is capable of, and allowing your body to relax and stretch and breathe, regardless of if it's through yoga or Tai Chi or swimming or walking. There are so many different ways to have this connection. I think that, the Eastern practices like yoga and Tai Chi tend to incorporate that mindfulness and breath work, but you can do this in any type of exercise. I know that when I would get into a long run, it was very meditative for me, right?
Definitely. And sometimes you need to upregulate, get focused on something. Sometimes you need to downregulate and turn off and all that stuff. So I think all that can be done through various meditation and yoga work. I hope you'll come back maybe and do some of that maybe with our listeners.
Yeah.
Since I know you do a lot of that, that would be so awesome. So I'm going to bring that down. And now we will move over to just chatting a little bit. But gosh, so many great things we've brought up and talked about. I'm really excited about all the different things that are out there that can help people on this journey. So I think the listeners as well hopefully are excited too. I'm going to bring over some of those questions that have come up, and so I'm going to start with this first question. It seems like our fertility challenge has affected desire, as we talked about a little bit in our presentation. What are some of the most helpful integrative strategies you recommend to support us both?
Yeah. So, I mean, that's a great question. So it kind of gets to the heart of the matter, right? Often when we're on the fertility journey, it takes away some of the spontaneity. It takes away some of the connection. I think about the work that we do in sexual health, where, there's so much pressure on being performative. How hard does the erection get? How many times are you having sex? Are we timing this appropriately? And that can take away some of the, that intimacy, which should be the foundation, the bedrock of your relationship. So how can we encourage that? Often I think about rebuilding the intimacy. So I think about the exercises that we have people do in order to build their communication skills, where sex and putting the penis inside the vagina or ejaculating is not the goal of that intimacy. Having opportunities to, give massage to one another. So there's a practice that we encourage where it can't culminate in taking your clothes off and rolling around. That's not the purpose of it. The purpose of it is to allow, to get and give pleasure and be able to communicate what that feels like. Hopefully that will help to build that intimacy, that communication, that connection, so that when you do move into the, okay, now is a good time for us to have sex because I'm ovulating, or the hormones are working, or it's Tuesday and this is our date night, then that makes that intimacy feel less like a chore or a thing to do that you've got to cross off the list. So, often we say, start with a foot massage. You give your partner a foot massage, and it's not about, genital stimulation or erogenous zones. It's more about like having them communicate what feels good, what doesn't feel good. Do you want more pressure? Do you want less pressure? Is this, pleasurable to you? Is it painful? What do we need to do? But if you can start developing that language in something as innocuous as a foot massage, then you can take that language with you into more intimate settings. And you get and give. You get and give a foot massage. Like you get your foot massage first, and then you time it, and then you switch, and the other partner is the one that gives the foot massage.
Yeah, I love Rosemary Bassan's model of sexual, which begins with emotional engagement. And so again, it's just reinforcing that emotional engagement, becoming engaged with each other. And we do something else we teach people called simmering, and you can simmer together where it's just touching, cuddling. You talked about earlier spooning, cuddling, and also don't make it that it has to lead to anything in particular. It may just be a wonderful, fabulous cuddle, and that's enough. What does it need to be today? And just let it be that. But I think all those things, that simmering, the kissing, the touching, the hugging, the physical touch, the different things can all be. And then the thoughts that come, the simmering sexual thoughts, that can help with desire too. So many things can help. But that was a great question. We appreciate that very much. My next question here was, you've done extensive work on pelvic floor health. Can you explain how pelvic floor dysfunction can impact fertility, pain, and arousal? And what steps can we do to begin healing?
Yeah, thank you for that. I think, we don't talk about our pelvic floor until something goes wrong. Okay. So until you start having pain, or until you start leaking, or until you start having problems with constipation, all of these things can impact our pelvic floor. And when we talk about health of our bodies, that's an important part of our bodies as well.
Mm.
So the understanding, what is your baseline? What are your, pain points? If you're not having pain, if you're not leaking urine, wonderful. That's great news. But for many of us that struggle with other issues, these are things that are treatable. And so by having a really good clinician that asks the right questions that you feel comfortable sharing information with, we've got pelvic floor physical therapists. We have yoga that's focused on pelvic floor. Mindfulness breathing into our diaphragm helps to stretch and strengthen the pelvic floor. All of these things are entwined in our health. So some people who have really tight pelvic floor muscles may have more pain with sex. And that can be something that we can work through with a good pelvic floor physical therapist and exercises. The laxity is often, a weaker pelvic floor often leads to problems with incontinence or constipation. So constipation could be either tight pelvic floor or loose pelvic floor. It just depends on what's happening, but it's some type of alteration, right? So understanding where our body is at, being able to have these conversations with a trusted clinician, letting your partner know where you're at. If you're having pain with sex, that is not why we're having sex. Like, this should not be painful. It can be challenging when you're trying to time it appropriately, but if you're struggling through painful sex, please reach out and see somebody, because this should be something that is, being intimate and being vulnerable in that way in a relationship it can be very scary for people. And to put words to things, especially when they're feeling broken or if they're not feeling whole, or if they've had a history of trauma, these are things to really begin to work through with good clinicians and a good support system.
And we so often see, and as Dr. Tenfeld said, you can have a high-tone, tight pelvic floor, you can have a loose pelvic floor, but often that high-tone pelvic floor will cause pain. Hormonal shifts will cause pain. Sometimes you've been on some sort of a hormonal birth control for many years, and that can shift hormones in a way that can cause pain, because that area, that vestibule area where you open the labia, is both estrogen dependent, but also testosterone dependent. So lots of things can happen with shifts with hormones, as well as with pelvic floor dysfunction, high tone or low tone. All these things can happen. And we've had pelvic floor physical therapists. So go back and look. There's some great episodes with pelvic floor physical therapists, and we talk about this more extensively. So lots of good resources on the website for you. I think we've had 2 different pelvic floor physical therapists.
Yeah, find the support people. Okay, there are good clinicians out there. They will take away the taboo, to be able to talk about things, because we are all invested in your health. We want you to be healthy. We want you to have a great sex life. I say that all the time to my patients. Like, I want you to have a great sex life. What is that going to take? What does that look like for you? How can we help you be safe? How can we help you be healthy?
Yes. So much we could talk about all night. I'm going to go to our centering exercise in a minute and then come back and thank you profusely for joining us. This has been such an awesome episode. But as we always do, I'm going to go to our centering exercise. And before we close today, I invite you to take a moment to connect with your miraculous body. Because sexual wellness begins with awareness and presence, embodiment. Get back in your body. So take a slow, deep breath through your nose and exhale through your mouth. Continue that pattern. As you exhale, feel your shoulders drop. Feel your jaw relax. Feel your heart soften. Release the tension in your abdomen, your pelvic floor, your thighs. Now, continue that breathing pattern in your nose, out your mouth. About 4 or 5 counts for each of those things. Continue that pattern. As you continue, place your hand over your heart and another over your belly. Continue to breathe. Notice the rhythm beneath your hands, the gentle rise and fall that reminds you that you are alive. You are connected. You are whole. As you continue to breathe, In your nose, out your mouth. Repeat and remind yourself silently or with me, I am present. I am present. I am worthy of connection. I am worthy of connection. I am open to pleasure and healing. I am open to pleasure and healing. I am enough. I am enough. You are enough, you beautiful creature. You are enough. You are enough. Notice as you continue and breathe and think of those things, let that energy fill you. Fill you up as you move back into the rest of your evening or day. Remember that intimacy and fertility aren't just about reproduction. They're about vitality, connection, and being fully alive in your body, in your miraculous body. Well, what's up next week, Vic?
Sexually transmitted infections are far more common than most people realize. They affect people of all ages and backgrounds. In this episode, Dr. Jeff is joined by women's health expert Amy Ho, NP. They discuss the latest facts on STI prevention, testing, and treatment. Together they bust common myths. They also explain why stigma can be more dangerous than the infections themselves. Amy and Dr. Jeff share practical, judgment-free tips to help keep you and your partner safe. Whether you're dating, in a long-term relationship, or simply staying informed, this conversation will empower you. Join us on November 25th at 7 p.m. Central Time to learn more.
Vic, he puts our Amy in my head. Amy Hole, Dr. Amy Hole, and myself. He's amazing with what he does with all these behind the scene things. But that was crazy, Vic. Very nice. I like that voice too. That was very interesting. It's going to be such a good episode though, and such an important episode on sexually transmitted infections. But for now, I would just like to really thank my incredible guest, Dr. Sandy Tinfeld, my friend and my guest, and she's so awesome. And you just were perfect for this episode. So thank you so much for participating. Anything you'd like to say as we close out our podcast to our listeners?
No, I'm honored to be here. I think that it's great what you do, and I just want to applaud that. And for the listeners that are out there, please find somebody who's going to listen to you. Find a clinician who's knowledgeable and non-judgmental and compassionate and can work with you to help optimize your health. We are out here, and you may have to find, you may have to try a couple of different people until you really connect. But I think having that support as you go through your health journey is really important. So I just wish you all the best on this journey through fertility and intimacy.
I couldn't agree more. Nothing replaces the importance of meeting with a really wonderful clinician, a qualified expert clinician. And so do find that person. And then what I know we both wish you is all of you is that you have more love, more passion, more happiness and joy and bliss in your life. Thank you for listening.
Who's Dr. Jeff talking?